Hi, welcome to another episode of Medicine Simplified. In this video, we will know about hair growth cycle, the total 4 phases of hair growth. Hair is a component of integumentary system and extends downward into the dermal layer, where it sits in the hair follicle. Humans have approximately 5 million hair follicles. Hair comprises living and non-living components above and below the epidermis level. So there will be two levels, which is one is above the epidermis and another one is below the epidermis, and also comprises living and non-living components. Above the epidermis, the hair shaft is thin, flexible cylinder of non-living keratinized epithelial cells. So above the epidermis, we will have non-living keratinized epithelial cells which are thin in shape. Below the epidermis, it is a part of living hair follicle that enlarges at base and forms hair bulb. Like skin, hair forms by rapid division and differentiation of stem cells, forming keratinocytes that migrate, flattens and die, forming keratinized cells. So keratinized cells are formed from keratinocytes. The final hair product exposed on the skin surface will be composed of entirely of keratin. This cycle can be divided into 4 phases: Anagen, growth phase; Catagen, transition phase; Telogen, rest phase; and Exogen, falling phase. Coming to the Anagen phase, it is an active phase in which the hair follicle takes on its onion-like shape and works to produce hair fibers. So Anagen is the first phase of hair growth cycle. The Anagen phase can be further broken down into pro-Anagen and meta-Anagen. In pro-Anagen phase, follicle proliferating hair progenitor cells and begins the differentiation process. The new hair shaft appears on skin surface to mark metagen phase. The Anagen phase as a whole can last for several years. Coming to the Catagen phase, it is the second phase in hair growth cycle, which begins with end of Anagen phase. During this phase, which can last a few weeks, the hair follicle undergoes apoptosis driven regression and loses about 1/6 of its standard diameter. So the hair will be shrunken to 1/6 of its standard diameter. The hair also separates from bottom of the hair follicle, yet remains in place during its final days of growing. Only 1% to 3% of hair on your head are in Catagen phase. The formation of club hair, an important prognostic indicator in assessing hair pathology like hair fall, is developed during this phase. Coming to the next phase, Telogen phase, it is a resting phase of hair cycle. In this phase, hair follicle is dormant and growth of hair shaft does not occur. Telogen phase typically lasts around 2 to 3 months. About 9% of scalp hair are in this phase. When new hair starts to form in the follicles, that just released hair during the Catagen phase is also known as Telogen phase. Coming to the final phase, called as Exogen phase, it is essentially an extension of Telogen phase of hair growth. This phase can last several months. New hairs are growing in follicles as old age falls away. During the Exogen phase, the hair is shed from scalp, often along by washing and brushing of scalp. Losing 50 to 100 hairs per day during this phase is normal. So there is no worry of hair fall. It is common in Exogen phase. These are 4 phases of hair growth cycle. If you like this video, please subscribe to our channel. Thank you.